Heart disease is the leading cause of death among women worldwide, and it's important to know the risk.
And the risk factors as well, and also some of the steps to maintain a healthy heart. Joining us to talk more in depth about that is Dr. Sandra Lerner. We're so glad you're here with us this morning, Dr. Lerner. So tell us, are there some preventative measures, or what are the key ones to take if you fall into one of these categories?
Well, I think the most important thing that we have to keep remembering is quitting smoking. All tobacco products are really the highest risk factor in terms of heart disease. But there are other really significant risk factors, and really the most important thing to remember is that heart disease starts 10, 15, 20 years before we ever see the first symptom. So it's important to really stay vigilant about our lifestyle, nutrition, exercise, and do the best we can in these areas.
So when you say it shows up 15 to 20 years before you see symptoms, when you go see your doctor, what are some of the questions you might want to ask your doctor to make sure you're maintaining that good heart health?
I'm really glad you asked that question. The most important thing is to really know your numbers. Monitor your weight, make sure that your blood pressure is well controlled, make sure that your blood sugars are normal, and have a yearly EKG. Make sure that you're following up with your doctor on a yearly basis. In our practice, we spend a lot of time talking about these risk factors, and they make a difference. It can prevent up to 90% of heart attacks.
So, Dr. Lerner, you mentioned knowing your numbers. What about knowing what some of these lesser-known symptoms are? Because I think we all know some of the common ones, right?
Right.
But what about things that you may not know to look out for?
Well, you know, in women in particular, it's really, the symptoms can be a lot more subtle. Heart disease in women is underdiagnosed by about 40%, and that's because the symptoms are more subtle. You can have chest pain, or you can have back pain, you can have abdominal pain, nausea, and the symptoms tend to be less severe, and so are really easy to miss and easy to ignore. So even paying attention to these subtle symptoms and getting early care and following up on them to get the appropriate testing done is really, really important.
You know, heart disease is something I think we associate more with males. Why is that so? Is it more prevalent in males, or is it just something that, you know, for some reason that became the message?
Well, it can be more prevalent, but as women approach 50, 55 years old, it really is about the same. And it's underdiagnosed because of these subtle symptoms that get brushed over or get attributed to other causes and present too late to get the appropriate care and prevention that is needed.
You know, with so much in terms of advancements in technology, there are so many new tests, right, year to year, and it's kind of hard to keep up with everything. Are there specific tests, preventative tests, that you can ask your doctor for the next time you go?
Absolutely. The most important ones are those basic tests. Know your cholesterol numbers. In our practice, we really spend a lot of time on getting more detailed cholesterol analysis. If you are having subtle symptoms as women, it's important to follow up with a little bit different testing, because it can present differently in women in a way that it affects more the microvasculature as opposed to the larger arteries of the heart. And so there are more specific tests that can be performed.
So if you do see some of those signs or feel some of those signs coming on, what is the first step you should take, and how do you get in contact with the right people?
Well, the first thing you should do is call your doctor and make sure that your doctor is listening to you about your symptoms and taking care of you in an appropriate way. Paying attention to your risk factors, following up. So those are, if you're having severe chest pain, of course, calling 911, going to the emergency room, getting early care is the most valuable thing you could do.
So something shouldn't be ignored when you see the subtle signs.
Exactly.
Definitely.
And we know that family history obviously plays a role. How much do diet, exercise, and stress factors actually factor in?
Well, all of those are really important. And I think managing stress is a big component of that, and I think it plays out in different ways for different people. Managing stress can look like managing your nutrition, getting the exercise that you need, and managing the other risk factors in your life. And so, but it can contribute really significantly to preventing about 90% of heart attacks.
All right, take a deep breath, right?
Right.
Relax.
We all need a
relax.
little zen.
Exactly. Dr. Lerner, thanks for coming in
Thank
this
you.
morning.
We appreciate it.